Board on. All right. More than halfway through the module. You guys did phenomenal on the midterm. You guys need to be clapping yourselves on the back. Um, see, you guys know statistics. Check that out. Now, I do want to give a disclaimer for today's session because it may be tough for some of you. We are talking about mortality rates as well as hospital autopsies. So I just wanted to let you know that if this is subjects that are kind of tough for you, I totally understand. Um, and this is where I'm like, okay, this is that one time where maybe the archive would be okay, all right? Because we are talking about some tough situations where we are going to be diving into mortality, deaths and newborn and infant deaths and different terminology. So I did want to give that disclaimer before we jump into it. Your apply and reflection preview is up on announcements as well. And for those of you who are watching this playback, if you were given a choice to give up your cell phone or your car in 2024, which would it be and why? And let's talk about it. When, and I can just kind of, while we're here, I don't know, growing up without a cell phone, it's like, meh. But not being able to get a ride, it's a double-edged sword, right? Like if you have a cell phone, then you can call for a ride, right? And if you have your car, then you can just go wherever you need. But then again, let's talk about it in the discussion forum and see cell phone or car. Which one would we give up? Okay, now, how many digits does the value of pi have? Of course, there's an infinite amount, and math is the language of the universe. So the more questions you know, the more you can converse with the cosmos. Thought that was super cute, so I went ahead and grabbed it for this evening. Okay, so right off the bat in chapter 6, we're looking at mortality, death. Okay, now this is the measure of the number of deaths in general or due to a specific cause. In particular, population, we are looking at that scale to the size of that population per unit of time. Now, we have to ask ourselves, how do we think variations in mortality rates can shape the overall health and well-being of populations? When we look at this question, we have to think about things like healthcare access and quality. We have to think about socioeconomic factors. We have to think about public health interventions as well as environmental influences, and then cultural and behavior practices. Recently, pandemics and epidemics come into play when we talk about these particular rates. Okay, so these are going to be some of the things that we're going to be diving in. With that, we're still going to calculate mortality, but we got to talk about hospital gross net, postoperative that I really don't like to talk about, or intraoperative anesthesia. Then those tough subjects I was mentioning, maternal, newborn, fetal, death rates, cancer, crude, and case fatality. The chapter does want you to know the difference between general, regional, and local anesthesia, as well as being able to calculate direct obstetrical deaths as opposed to indirect obstetrical deaths. Okay. And then we'll jump into autopsies in the next chapter. Now, by typing yes or no, did you guys know that death is a type of discharge or disposition in hospitals? So, yes, you knew, or no, you didn't, but I'm curious as to how many of you guys did know. So, go ahead and write if you are able to type, if you did know that death is a type of discharge that we calculate. So, okay, so Miss Asha said yes. Okay. Now, with that, we're looking at total number of discharges. Deaths are automatically considered part of that total unless specified otherwise. Now, with that, when we're counting deaths of newborn inpatients, now this is going to include discharges of newborn inpatients. This is that time when the newborns are put into our calculations. Why? Because newborns contribute to the overall mortality rate unless a facility chooses to calculate them separately. But now we're including them in, whereas to before, you guys remember, we did not do that. Now, patients declared DOA are not part of the hospital inpatient mortality rate because they were never admitted, right? Similar, patients who die in the ED or as outpatients are also not included in the inpatient mortality rate. Again, they were never actually admitted into the hospital. So, recapping from the midterm, you guys did phenomenal. So I just grabbed some random questions because you guys did really well. If a researcher is able to measure what he intended to measure, this is referred to as A, reliability, B, competence, C, validity, or D, consistent. See if you guys remember. Reliability, competence, validity, or consistent. A, B, C, or D. This one is validity. And the next one, DRGs may be grouped into major diagnostic categories, procedural categories, or clinical modifications. So MDCs are major diagnostic categories, procedural categories, or clinical modifications. This one, that is correct. Major diagnostic categories. All right. Now we're getting into some formulas. Now, this chapter, as well as next chapter, are formula driven. There's a lot of formulas. And so I've tried to grab as many and we're going to kind of work them out. So if you have your calculator with you, I'm one of those that trust but verify. All right. Because more eyes are better. Okay. Now with that, looking at the gross mortality rate right off the bat, the hospital had 7 deaths and 520 discharges, including deaths for a month. What is the hospital mortality rate? And we're paying attention to this term right here, rounding to the nearest 10th. Now, to calculate the mortality rate, you can use that formula. Hospital rate, we have number of inpatient deaths, inpatient deaths, including newborn in a period, divided by number of discharges, including deaths in that same period. So you're adding what you do in the numerator, also again in the denominator. 7, yes. 7 deaths divided by 520 discharges. 7 over 520. Now, rounding to the nearest 10th. Okay, so you can always multiply by 100, or you have your 0.0134. With these particular questions, you're going to usually get some options, right? So if you only see like 0.0134, 0.01, blah, 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 then you'll know that you'll be like, okay, nearest 10th, 0.13, or if they're saying, or if you see like the 1.3, 1.2, 1.4, you guys get it, then you will definitely click the 1.3%. Okay. Again, it's going to be based on how that particular facility chooses to report their data. So 1.3% when rounded to the nearest 10th. And what you'll notice is a lot of these formulas are going to be the same. The difference is the term in front. Okay. Case fatality rate. So if you notice, gross mortality rate, case fatality rate, now we're looking at the number of patients with a disease during a particular period divided by the number of patients discharged with a disease, including deaths for that same period. Now, here, if a hospital had 40 acute myocardial infarctions or AMI discharges, including deaths last year, and 8 deaths, what is the case fatality rate for AMIs? Again, we're rounding to the nearest tenth. We start off by just writing what we're looking for. Here, AMI case fatality rate. 8 divided by 40 times 100 gives you 20%. Okay, so you see the pattern already, right? I bring that up because in example 3, let's say you're at a hospital and you're like, we want to know what's going on with Dr. Howard, for example, right? So we're going to actually go ahead and grab his case fatality rate, his or her case fatality rate. It can be used to examine the mortality rate by physician. So if Dr. Howard discharged 600 patients in the past year, and of those patients, 27 died, the formula will now be, instead of AMI case fatality, Dr. Howard's case fatality rate, right? So 27 patients died, he had 600, 27 over 600. And make sure you guys are checking my work, okay? Because just because I have it up there doesn't mean that to err is human. Okay, so we have 27 divided by 600. Did anyone get anything different? No. Okay. Now I'm going to ask you guys a question. Why would it be important as a patient or even a family member to know a doctor's case fatality rate? So we're not even talking about the hospital. You as a patient or a family member, you're getting ready to go, let's say for a big procedure, right? Why is it important to know this particular doctor's fatality rate? I don't want to die. It, hello, say it again. Say it again. Yes. I don't know if you guys remember when the BBLs paper were going to the back of people's garages and all kinds of stuff, and they were unaliving themselves. Well, not unaliving themselves, but they were going in alive, coming out unalive, right? And homework wasn't being done. Safe practices promote longevity in the field. That is correct. Lets you know how well he cares. Also correct. You want to know so that you go in, you're coming out, hopefully better than you went in, right? So this is one of the things that they are definitely calculating. Also, on the hospital side, malpractice, right? You bring in a doctor and the hospital's rating is pretty good. Then all of a sudden, certain patients are not coming out alive when a certain doctor is pulling out toenails. What are you doing, sir? Or ma'am? What's going on? Why is there mortality rates for toenail removal? Of course, I'm being extreme, but you guys can kind of see it. Next thing you know, people aren't going to want to go to that particular hospital. I know for me, no ma'am, no sir, right? We also look at net mortality rate. Now, this is a specific way of just calculating mortality. It excludes deaths that occurred within 48 hours of admission. We compare gross mortality rate with the fact that now you're looking at net mortality rate is typically lower than gross mortality rate. And now this is because it does not include those deaths that happen very shortly after admissions, which might not be directly related to the care provided by different healthcare institutions. We're also having the inclusion of newborns. Now, the net mortality rate includes death of newborns. This is important because newborns have that unique healthcare need, including them in mortality rate, just regular mortality rate calculations. provides that comprehensive view of the healthcare outcomes for a specific group. We also look at requesting by reporting and accrediting agencies. They want to know what's going on. They want to see the entire picture. So they may ask, hey, I want this particular rate as opposed to another one, and also known as the institutional mortality rate. So you may see net mortality, but keep in mind another term, also known as institutional mortality rate. Okay. With that, calculations. Now, here, number of inpatient deaths, right? Minus number of inpatient deaths within 48 hours of admission divided by total number of discharges, including deaths, minus number of inpatient deaths within 48 hours. So here's our example, example 4. Last month, community hospital had 255 discharges, including deaths. 3 of the deaths were patients who were in the hospital less than 48 hours. So keep that in our mind. We're like, okay, 3 less than 48 hours. We know that's important. What is the net mortality rate? Again, we're rounding to the nearest 10th. We get our net mortality rate, 9 minus 3 divided by 255 minus 3. Okay, I'll let you guys kind of calculate that really quick because I already multiplied it to get the final answer. Y is which one? What's the question? I see why is that? Safe practices for the net mortality rate?
Just in regards to the 48-hour period, like why is it 48 hours exactly? Why not 24 hours?
That's a great question. And this is just me assuming without kind of like diving in deeper. Within the definition, they were saying how a lot of things can happen within a 48-hour period in medical that isn't necessarily going to be directed. So they have this like blanket, and if anyone else has dived in, jump in. But from my understanding, it's kind of like that 48-hour period where anything can happen. 24 is not long enough. So they include 48 hours almost as a safety net. A lot of times implications can happen after 48. In the hospital, in the operating room, for example, a patient can have a tonsillectomy, and we know that 48-hour period, not 24, is critical, where in 24 hours, you may not be able to see that there's a bleed, but at 48, you'll definitely know. So I'm actually look out more and get back to you guys. But from my understanding, that's why we do 48 versus 24, just to give us more of that. I hate to say cushion, but you may have different complications that aren't going to be necessarily related directly to. So it's kind of like that cushion. Does that kind of help? And don't worry, I'm going to look it up just to make sure. Yeah. So I'm definitely going to look that up. Y'all know I'll send you guys an announcement after I've looked it up. So a great question. All right. So I got 2.4%. Okay. It also says excluding deaths within 48 hours in the net mortality rate allows now this is from the book, allows for a more accurate assessment of the hospital's performance by being able to kind of focus outcomes influenced by the quality of care provided over a longer period versus the 24. So again, we talk about standardization. That could be another reason, right? We're looking at standardization where everyone's going to have that same policy protocol based on different, how do you say, policies from joint commissions. Okay. But from the book, that's what it says. I'm still going to look it up from other sources, but that's just what the book says. Now, this standardization does prevent bias from early deaths that may not be directly related to the hospital's intervention. So again, it does help with comparison between different healthcare institutions. So what I was saying, straight from the book, So yeah, but I'm still gonna look it up. Okay. All right. Postoperative. Now, being in the operating room for a while, I get a little, you know, in my feelings a little bit because ideally we don't want this, right? But things do happen. Now, this is referring to the number of deaths occurring after an operation has been performed. It's also called surgical mortality rate. Okay. I'm gonna let you guys in a little secret. We tend to not want patients to pass away in the operating room. We do everything we can, as you guys know, to save them. But if it does look like it's going to happen, I have personally been in cases where we will kind of close them up so they can pass with like family members if we know they sign knowing that this is a possibility. So we do try to do that when at if at all possible. Okay. Because we really do not like patients to pass away in the operating room for a lot of different reasons. Now, the example that we have here 123 patients were operated on in the cardiovascular clinic at University Hospital. Three of those patients died within 10 days of their operation. What is the post-operative mortality rate for the cardiovascular clinic? Here we are rounding to one decimal place. Okay. Start off with the post-operative death rate. We know that there were three patients that died within 10 days of the 123 patients. Again, with your calculations, right? So at this particular cardiovascular clinic, which is actually pretty good, 2.4%. And the reason I say that is because heart cases and heart, that is that is a very good rate. Trust me, that's a very good rate. Okay. Now, the calculation involves looking at the number of deaths within 10 days, right? The chapter wants you also to know the difference between a surgical operation and a surgical procedure. Now, we're looking at the total number of patients who underwent surgery during a specific time period. When we talk about medical context, a surgical operation refers to one or more procedures performed on a patient at the same time, typically for a shared purpose. A surgical procedure, on the other hand, is a single distinct process performed on or within the body, often by a licensed practitioner. It can be with or without instruments. These procedures are commonly carried out to restore or replace body parts, remove diseased or injured tissues, pulling out teeth or extract foreign matter, assist in childbirth, or even aid in diagnostic procedures. So, an example of a surgical procedure could be an irrigation and debridement, where we're bringing the patient in, maybe they were in a motor vehicle accident, and other things were done prior, and now we're just kind of doing cleanup. So we'll bring them in. We will use saline to kind of just irrigate whatever, and then we debride. All right, where we're taking or scraping anything off of the body. A surgical operation, I want you guys to think of like a coronary artery bypass or a cabbage where we're going in, it's involving redirecting blood flow. We may have to put them on bypass where we're pumping the blood for them for whatever reason. A heart transplant, so it's a big case. This is commonly done to improve blood supply to the heart. All right. So surgical procedure versus surgical operation. Make sure you do know the difference because I have seen questions on your final as well as your week 6 feedback in the past. Okay. And you never know, you may get that question. You also have to know the difference between the different anesthesias. Does anybody know right off top of their head the 3 main types of anesthesia? And if you don't, that's okay, because I'm going to tell you.
You're talking about like local?
Yes. Local, that's right.
That's right.
I'm trying to think what's the other one.
I'll
I
give
don't
you a,
Give you,
I'll give you
I'll
a
give you
hint.
a hint.
General,
General,
yes,
yeah.
yes.
know.
Local, general, and the last one, um, regional. That is correct. I was gonna say anyone had babies. I know I got an epidural. I got epidural, and I loved it. Anyways, so make sure you guys know the difference because you will see questions on which type of anesthesia, right? My BFF, which type of anesthesia induces overall body sleep, general, or out of the three types of anesthesia, which one numbs only a small area of the body? Okay, so make sure you just have a good understanding. Also, another way to kind of bring it together, general anesthesia, think major surgery. You have regional, childbirth, epidurals, and then local, that patient coming in for that toenail removal, where we're just going to put in some local right around that area. Okay, we're almost done with this chapter. We also look at maternity mortality rate. You're going to calculate it pretty much like we've calculated everything else, except now we are specifically looking at maternal mortality rate. All right. Hospitals typically classify only direct obstetric deaths as maternal deaths. This includes cases prepartum, which means before childbirth, and postpartum, which is after childbirth. Okay. Public health and policy studies, they use these vital statistics for a lot of different reasons. So just keep that in mind. Here are the following terms that you definitely need to know because they love to use this, or I say we love to match these terms because they're so close. So really, 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 I'm going to send this to you guys, but make sure you really have a good way of kind of like, okay, the first 28 days is this, and infant dies after the first 28, but before the end of the first year, it's called postnatal. So they really do, and I've seen this matching a lot, okay, on different types when it comes to newborn mortality rate. But I will send you guys this. I'm going to email it to you. I think it'll be easier. So I'll send this to you guys in Outlook this evening, okay? So you guys can have that. We also just breaking down fetal death. Now, we're talking about products of human conception, fetus and placenta. It doesn't show signs of life after being completely expelled. And I hate the terms, but this is, expulsion and extraction. Fetal deaths are not considered patient deaths and they are calculated separately. So just keep that in mind. Okay. Another thing that you're going to get emailed today, another classifications, length of gestation, and then different weights. I have seen them break this down in a number of different, we have broken this down in a number of different ways, okay? Whether it's matching or they may even do multiple choice in the knowledge check and your quiz. So again, this is another one you're going to really want to kind of just 20 weeks gestation, that's fetal early fetal, all right? Keep in mind that both intermediate and late fetal, these two, consist of what is commonly termed as a stillbirth, all right? So intermediate and late fetal. Again, I have seen these terms in this table on the week 6 quiz as well as your upcoming final. And then cancer mortality rate. And I grabbed this one so that you can kind of see how it is calculated just like everything else. But now we're talking about the US cancer mortality rate for specific time period 2017, right? Number of cancer deaths over the US population in 2017. We have 599,108 divided by 325,719 and 178. Okay. A lot of numbers. And then reported as per 100,000. And then, of course, round it to the nearest 10th, 183.9. All right. Now, this ties up chapter 6, looking at mortality rates. But in chapter 7, we're going to be looking at autopsy rates. Okay. I don't know if this is a fun fact, but in 1960, 50% of all people who died in the hospitals were autopsied. Since then, percentage has just almost fell off. Now, according to the journal, a main reason for the decrease in autopsies was the decision in 1970 to abolish a rule requiring hospitals to autopsy 20% to 25% of patients to maintain accreditation. So now they don't have to maintain their accreditation by autopsying patients. So I just thought that was interesting. And of course, that was before most of us were born, but that's still kind of like, wow, before 1970, that's a lot of people that were just being autopsied just to maintain accreditation within different hospitals. So we're going to look at the terms. We're going to recognize a coroner's case because that's a little bit different. And then you guys know we have calculations, gross, net, adjusted. And there is also some software that you can use to complete a lot of different spreadsheets. Breaking it down with autopsies, or you may see a post-mortem examination. Again, this is the study of a deceased body. Autopsies can involve the entire body, or it can focus on specific organs. It's going to be conducted by the hospital pathologist, which I have seen this question, or a designated physician on the medical staff. I don't know how they do it. I really don't. Autopsies are usually done in the morgue, right? Now, in some smaller hospitals without morgues, bodies may be taken to an off-site lab or funeral home for examination. They make money, and this is probably weird to say, they definitely have business, without sounding too, non-PC. Kind of like funeral home individuals, right? Now, the autopsy rate here is the ratio of all inpatient autopsies to all inpatient deaths during a specific time period. Typically, it's going to be reported as a percentage. You have your gross autopsy rate, which includes newborn autopsies, and then your medical staff committees may decide to calculate newborn autopsies separated or separately, just if for whatever reason they're like, we need to know just this section. So we're going to not do the newborns at this time. Again, like I mentioned, chapter 6 and chapter 7, a lot of calculations. Here we have January, University Hospital discharged 1,027 patients. The hospital had 32 deaths, which included newborns, and they performed 11 autopsies. So, gross autopsy, we have 11 divided by 32, 0.34375. We have to convert that to a percentage, right? Because we want to round to 1/10 of a percent. 0.3475 times 100 is 34.375, but we got to round. Nearest 10th is 34.4%. So you'll probably see 34.4 in it. But yeah, 34% if you see whole numbers or whole percentage. But yeah, 34.4 because we are rounding to the nearest 10th of a percent. So they want that extra section after the decimal place. But yes, that is correct. And that would be per facility. Some facilities want that extra. A lot of facilities will just say, just give me the percent. Now, we're going to break down the net autopsy rate. This is a ratio that we use to measure certain autopsies within a certain time frame. It's going to be calculated by taking all the inpatient autopsies during the time and then dividing it by all the inpatient deaths. But here's the quick twist. We have to subtract unautopsy coroners or medical examiner cases. Now, why do we do this adjustment? Okay, there are specific cases where a coroner or a medical examiner who's responsible for investigating certain deaths might come in and be like, this is my case, I'm taking charge. These are usually unintended, so violent, unexplained deaths, and the coroner is determining the actual cause of death. So we're going to take those out, right? The term coroner has a historical origin related to the English crown, but in some places they're called medical examiners. Again, I've seen that on your final exam, okay? Here's the thing though, when a body is released to the coroner or medical examiner, it means the hospital's pathologist won't perform the autopsy. So when we calculate that net autopsy rate, we're looking at an inpatient autopsies done at the hospital, excluding cases where the coroner is like, this is my patient, I'm done. I know in the case of an emergency, do you have a DNR? I like that. So now you see why we remove the cases that the coroner has, because they're investigating, they're trying to figure out what, when, where, how did this patient end up in the situation that they're in. We look at hospital inpatient autopsies versus a regular hospital autopsy. Inpatient, I want you to think of postmortem examination done at the hospital versus a hospital. It can occur for someone who has been in the hospital at any point. Okay, now this includes emergency, outpatient, home health, and others who were traced being treated at a particular hospital for whatever reason. Okay, so hospital inpatient, they're actually in there. Hospital autopsy, they were at there at some point. Okay. And then we have to adjust sometimes. Now, when we look at the adjusted hospital autopsy rate, we're talking about the proportion of hospital autopsies performed when patients' bodies are actually available for autopsy after their deaths. Now, while many hospitals, they will calculate the net autopsy rate for external reports, the adjusted rate provides just a more accurate reflection of what's going on with the hospital's resources for physician education because it includes all autopsies. Now, patients whose bodies are available for hospital autopsies would include, of course, those inpatient deaths, special cases. So like, let's say the hospital pathologist performs the autopsy as an agent of the coroner. Both the autopsy and the death are included in the adjusted hospital autopsy rate formula. And then, of course, there's other patients where maybe they were in hospital home care patients or they were outpatients, but they were previous hospital patients who died somewhere, but made their bodies available for that particular hospital's autopsy. And then, of course, you guys know we have formulas, right? All right. Community hospital, 260 discharges in June, 7 were deaths. Hospital pathologists performed 3 autopsies during this period. 2 home healthcare patients ended up at that hospital, right? And 1 outpatient died, and they were also brought to that hospital. Now we're going to calculate the adjusted hospital rate. We get our formula. Okay, so 3 plus 2 from the home healthcare, and then that 1 that died outpatient. We have 7, and then again 2 and 1 because you're still adding the home health and that 1. So this is where I'm getting these numbers from. 6 over 10, right? 0.600. Convert that to a percentage, 60%. Okay. And we are looking at the adjusted. So again, we get these 3 on the top because I want to make sure you guys get this. 3 inpatient, 2 home health, 1 outpatient. In the denominator, all the patients whose bodies were available for autopsy. Now, it's not saying that they were all autopsied, but these are the patients that were actually available. That's why we have the 7 deaths. Now, we know that 3 were done, but 7 were available. Okay. So you have your 7 plus your 2 plus your 1. So that's how we got the denominator 7, 2, and 1. All right. Does that make sense? I don't want to make sure you guys got that before we move on, because we're talking about all the ones that were available. You guys are good. I'll leave it up for a little bit. Okay, we're almost done, you guys. I promise. A lot of calculations. Okay, now fetal autopsy rate. Again, we have our formula. And in this case, we're looking at University Hospital's newborn service reported 10 fetal deaths last quarter, 2 early, 6 intermediate, and 2 late. Of these, the 2 late fetal deaths and 1 intermediate fetal death were autopsied. We're looking at the formula. So let's get our formula ready. Fetal autopsy rate. We have our 3/8. Right? Because you see 6 plus 2. So 8. And then you have your number of autopsies reported, 1 intermediate and 2 late. Gives us 0.375. But we need to round to the nearest 10th of a percent. So we want 1 past the decimal place. 0.375 to get that to a percentage, multiply by 100 to ensure that we are complying with this particular facility's requirements, 37.5%. Okay. Formulas, formulas, formulas. Again, I think I'm going to send you guys an email with all of this. I noticed that some were able to see it on the announcements and some weren't. I want to make sure you guys have this information from this evening. So be on the lookout for an email from me from Outlook, okay? That'll have all this information. I don't know. It may be a group email, so you guys don't respond back. I think that may be the easiest. So I'm kind of working that out. All right. We're going to go over a couple of knowledge checks, and then I'm going to get you guys out of here. All right. So this is most likely how you guys are going to see with all of these formulas from chapter 6 and chapter 7. If a hospital had 7 deaths, and hint, hint, we've seen this one. If a hospital had 7 deaths and 520 discharges, including deaths for a month, what is the hospital's mortality rate? Round to the nearest 10th. You have your options 1.1, 1.3, 1.4, and 1.2. That is correct. 1.3. So this is a perfect example, right? When we know that when we want to round to the nearest 10th, especially when it comes to a percentage, we want that 10th space right after the decimal. So 1.3. Okay, so good job. And the very next and last one I grabbed too. And if you guys want me to grab some more, y'all just let me know and I'll try to grab more of that. So you guys can kind of be exposed to a little bit more. During the last semi-annual period, University Hospital had 6,234 discharges, 18 deaths, and 15 autopsies. What is their gross autopsy rate? Report the rate as a percentage and round to the nearest 10th. Again, we want that spot right after the decimal places. You have 81, 83.3, 80, and then 82.0. And I will break this down. Has the answer. I was hoping I could just break it down without having the answer. Well, you have 15 autopsies divided by 18 deaths, giving you 0.8333 times 100 for 83.3%, and then round it to the nearest 10th, giving us a correct answer of 83.3. We got that nearest 10th or that 10th space right after our decimal. So a lot of calculations tonight, right? But you guys got it. Easier said than done, right? Well, we are at week 6, which means it is going to get faster and faster and faster. We did cover mortality rates. We had a lot of calculations on the different types of mortality rates, as well as chapter 7 dealing with hospital autopsies and autopsy rates. For those of you who are watching, again, if you were given the choice to give up your cell phone or your car, which one would it be and why? I've already shared that for me, growing up without a cell phone, I don't know. Someone said the car. For your math trivia, how many digits does the value of pi have? There's an infinite amount of numbers. And math is the language of the universe. So the more equations you know, the more you can converse with the cosmos. If at any time there is a question on some of the work, your plan reflection is up on announcements, but if there's one that I didn't grab or that you would like me to see, let me know. You can't be without a car. That is true. Um, some people do Uber. I know, like in New York, I guess it depends on where you're at. For me, I would have to stay with my car because everything is too far away for me. But you know, it's we'll talk about that in the discussion forum. And then for those of you who are here, I'm seeing that some of us are having the same thing. Car costs way too much. It's I can always use an app. It means no network. There you go. All right, you guys. Week 6. Next week is week 7. We are actually on our road to the final. You guys really did phenomenal on um your midterm. I hope y'all were sitting back like, we got this. Y'all need to clap yourselves on the back because you guys really did good. I know some of you guys maybe not have even had statistics in a while and y'all did that. So we're going to keep pushing. We're going to knock out this. And here's just a little secret. Once we get to weeks 9 and 10, we're done with calculations. Then we're going to just get into some research terms. And then in week 10 is where we briefly touch on the statistics part of health statistics. We're going to get into some t-tests, chi-square. We're not calculating them, but we're going to break down the terms. Okay, so a couple more weeks of calculations, and then we get into different terms. If we had zombie cigar, I love it. All right, y'all, and pretty soon you guys will be in module 7, getting ready to graduate. So there is light at the end of the tunnel. What questions do you have for me? Any questions? Right.
Are we gonna have you again or no?
Yes, you guys get me for one more module. And
Okay.
then
We're good.
you guys do get me for one more module. So um that's all I have, y'all. With that, I'm trying to think, is there anything else? We've already had, yeah, we pretty much it. We will kind of like just get together before the final so that I can kind of get what you guys want to kind of focus on. You will get your recap on what you guys are going to be getting in email, not an announcement, not a Moodle message. I'm going to send out a group email. So you don't have to respond back, but it's going to be a group email with your formulas for this evening, as well as the terms. And y'all know I'm going to be looking up the question just to make sure I know what the book says, but I am that person that I want to know. I just want to know. For your final, you are going to get your formulas. Me and Mrs. Cotton are on the same page. When you're taking that final, I want you to have those formulas right there with you. Okay. And you will have all of that. And I'm just going to do that I'm going to send that to email as well, just because I'm not sure what is going on with Moodle, and I want y'all to have that information. Okay, I really want y'all to have that information. For your CST or your CST, for your RHIT, you do have one formula that you will need, but Miss Cotton gives that to you, and you will be able to have that for your RHIT. But you guys already know it, so it's pretty much we'll cover that particular formula in week 8, and you'll have that as you go for your RHIT exam as well. Okay. And I'm saying it because y'all, it's right around the corner. Also, y'all need to be looking at jobs because again, it's going to come so fast. So be looking, make sure you're reaching out to Melissa, Raposa, because she is here. We talked yesterday and she's ready. So some of you guys that have already sent in your resumes to her, or if you haven't yet, reach out because she is really ready to kind of like get the ball rolling. And the sooner, believe it or not, the better. That way we're already aligned and we can get you guys in the field. I'm not gonna take any more of your time, but it's always a pleasure. I love this class. I love this class. Anyways, you guys have a wonderful evening. Have a wonderful rest of your week if you guys are celebrating. And I will see everyone who can attend week 7's live session. Buenas noches. Good night, everybody.